Good afternoon, everyone. My name is Chris Carter. I'm with MIU Health. I'm here today to talk about the power of social networks to leverage behavior change. Pictured here on the screen is a social graph, social network map. If you were around for the previous speaker, Pete Dewan from Med Networks, you heard a lot about the power of influence bottled up in one of these graphs. My intent today is to really talk to you about how to unlock that power to create real-world applications that help people change their behavior. We operate out of offices in Boston. MIU Health is a wholly owned subsidiary of Healthways. We have a team of game designers and engineers who come out of the mobile, web, and game space to build interactive applications that connect people together and to improve their well-being. MIU Health promotes everyday well-being by encouraging the small actions and fostering the social ties that drive meaningful behavior change. We build product around a central question. What would it take to get a few minutes of your time each day to complete one small action designed to improve your well-being? For us in building consumer-oriented products, you have to boil this down to very simple interaction design. And here's an example of the kind of simple challenge that we pose to people on a daily basis. Pledge to replace an alcoholic or sugary drink with water or sparkling water. Now imagine for a minute what one person could accomplish just by doing this in terms of reducing their own weight. And then imagine what it would look like for 100,000 people to reduce their sugar consumption by cutting out one soft drink a day. That, in fact, is what we have done at MIU Health. We have launched a program called Daily Challenge that has gone from 0 users to 100,000 users in just under 8 months. In that period of time, our users have completed 1 million daily challenges. Now, you heard from Pete Dewan about the power of influence and the connected nature of all of us when it comes to health behavior. It's easy to see that changing the behavior of 100,000 people has a ripple effect, and you begin to have interesting and very powerful population effects with this kind of approach. So before I walk you through elements of how we design the Daily Challenge, I wanted to address some of the design influences that we brought to this. They have to do with behavior change, network science, game design. On the behavior change side, in addition to the work of the Prochaskas and traditional stage of change theory, we've really been interested by the work of this guy, B.J. Fogg at Stanford University. B.J. has a lot of information published on the web. I highly recommend that you take a look at it. One of the things that I want to draw to your attention is this: dot behavior, span behavior, path behavior. Let's take these one at a time. A dot behavior is something that you might do one time, like floss your teeth, if you haven't been able to bake that into your routine. Span behavior is repeating that task or behavior over a span of time, 40 days, 30 days. And a path behavior is when you bake that into your daily routine and it becomes part of your life. That's clearly the goal, but the question is, how do you move somebody from a dot behavior all the way to the point where they have fully incorporated that behavior change into their lives? Now, Fogg has created a broader framework, which I'm going to simplify here and focus on these core ideas: dot, span, and path behavior. The question that we wrestled with up front was, can you change behavior by starting with a dot? So here are some examples of what we mean by dot behavior. Measure and record your waist size. Write down one word that represents a happy memory. Can we use these simple challenges that can engage people in a few minutes each day to really promote long-term behavior change in this application? Turning to game design, As I mentioned, we have a whole team of gamers who I've learned a lot from about the nature of these things. Any good game incorporates these facets into it: exploring, achieving, socializing, and competing. And ultimately, this isn't about fun. It's about creating a fulfilling, engaging product. If anyone has figured out how to really engage people over a long period of time, the gamers have, and we've been leveraging those mechanics in our design. Another important lesson coming from the game world is that behavior change is less like a process and more like a game. On the left here, if we can go back up one slide, on the left is what we mean by a process-oriented behavior towards a clear goal. Imagine for a minute the typical weight loss program where you set a goal: I'm going to lose 10 pounds, and I'm going to walk through these sequential steps to get there. More often than not, it doesn't work. On the right-hand side is what we mean by a different path towards that goal. The goal is fuzzier. The path becomes a journey on the route. The lessons learned from social network science are numerous. On the left is the work of Christakis and Fowler. This particular diagram, social network chart, relates to their work on smoking cessation, where they discovered, by studying real-world networks over time, over decades, that people, in fact, quit altogether. My colleague, Nate Cobb, who is a collaborator of mine at QuitNet, Nate was the inventor of QuitNet, a large-scale smoking cessation service, and pictured here is a social graph of the QuitNet community that shows how people in this social support program are connected together. The red dots indicate those people who are in the program who are still smokers. The blue dots indicate those members of the community who are abstinent. And it shows two interesting things. One is that the smokers and the non-smokers aggregate together, but there's significant intermingling between these two communities. The next slide indicates the dynamics of that therapeutic community that was built online. This shows, in this case, the blue dots are existing QuitNet members, the red dots are new members, and this depicts in this animation how the new members are incorporated into the fabric of this social community. So the question then is, how did we use these design influences to create an application which was designed from the ground up, the Daily Challenge, to help people improve their well-being? This is the start page of the site. This is a free service available to anyone. We built it and designed it so that it connects via Facebook. Very simple onboarding, one-click enrollment through Facebook, which allows us to access a subset of your Facebook information. You give the application permission to do this. We can access your profile picture, your friends list, your email address, and this becomes a powerful mechanism to jumpstart a social experience online. The reason to work with Facebook is obvious. 600 million people on the planet use Facebook, many of them on a daily basis. Facebook has fast become the infrastructure for social experiences online. By connecting with the program through Facebook, we were able to operate at arm's length with the Facebook application, so that it makes it easy for our members to invite their friends, to have private conversations. There's no data that goes back to Facebook unless the individual member wants it to. Pictured here are the Facebook friends that you're encouraged to invite. The invitation gets posted out to your friend's Facebook wall. And the proposition here is really to create a small network of your real-world friends to become part of this community on the Daily Challenge. As Pete Dewan showed at the end of his previous presentation, Facebook, typical Facebook user has hundreds, 280 or so Facebook friends. These are typically very weak social ties. Our proposition to our members is don't bring all 280 of your Facebook friends. Bring 5 or 6 or 10 or 12 people with whom you want to have a really powerful, more intimate experience in working on your well-being. The actual user interaction with the product is mediated primarily by email. Our intention, again, is to design this in a really simple way so that anybody can use it, and it only occupies a few minutes of your time each day. At 7 a.m., we send an email challenge, as this one indicates. Ask a friend or relative to name 2 things you're really good at. The program addresses a wide range of well-being domains, including emotional health. At the bottom of the daily email is social proof. Here's what happened yesterday. Here are your friends who completed yesterday's challenge. Here's the points you earned, the badges you earned. And we ask that you click done and check in. In the event that you haven't checked in by 4 p.m., you'll get a reminder email that looks like this. Again, at the bottom, there's social proof about your connections in the program who have already completed the challenge that day and how they did it. Here I want to just draw your attention to something that's really powerful. To really build a socially interactive site where most people participate is really tough on the internet. You have to keep the value proposition really simple and the user design really simple and compelling. We have over 5,000 people who post how they did it, how they did that day's challenge every day. Another 5,000 or 6,000 people reply, yielding rich conversations about well-being. Over half of our users post such messages. Typically in a user community like this, you might see 5 or 10% of the population generating the actual content that people consume. Pictured here is a feature I won't dwell on too much, but I wanted to call your attention to it. We've incorporated into the Daily Challenge a simple 42-question assessment called the Well-Being Tracker, which is derived from the Gallup Healthways Well-Being Index that quantifies the nation's well-being. We wanted to build value around this idea of an individual getting their own score, and not only getting their score one time, but revisiting that questionnaire over time so that they could track changes in their well-being over time. Pictured here is one of the reports that is generated automatically within the program that breaks out the individual scores by well-being domain. 44,000 people of our users have completed this assessment. Almost half of our users have taken the full assessment, again, without any monetary incentives. They're really just interested in learning more about their well-being and exploring about well-being and getting their well-being score. We also have taken the innovative step of allowing you to compare your well-being score to the score of your friend network, and again, to the broader network of Daily Challenge users. So that's the basic interaction model. There's more to it, but it's really quite simple. Morning email, afternoon reminder email. You can engage with the program through SMS messaging or mobile applications, but that's the basic mechanic. Now let's look at some of what's going on under the hood. The Daily Challenge now has 100,000 users. We've been working with our partners at Med Networks to analyze that network to begin to understand the patterns that we see in how people are connected in the program. Looking closer at this, you begin to realize that there are communities within the community. The purple dots are all connected together. The green dots are all connected together. Now, keep in mind that we have broadly advertised this program and recruited individuals who are then invited to bring in their friends. Typically, there's a handful of those friends enter the program. And then beyond that, it continues to spread and forms these interesting communities. Why is this important? This slide shows why this is so important. Connecting with your friends drives engagement in the product. It's that simple. We see very strong correlation between the number of friends you have in the daily challenge, which is the axis along the bottom, versus the completion rate of daily challenges in the program. So a user with only, with 0 friend connections still has a significant completion rate of over 20%. But as you add a few friends and get up to 10 or 12, your completion rate of those daily challenges increases dramatically to over 80%, showing the power of these social networks. So pictured here is an animation that we're going to run that shows how the invite process works across the Facebook friend network. Individual daily challenge user is in the middle. They invite one of their, a number of their Facebook friends. Some of those people convert to members, and you begin to see how the daily challenge propagates across people's social networks to build this rich fabric of a community linked together by their willingness and desire to engage in well-being sort of daily activities. But, of course, life is a little more complicated than that. These aren't really donuts. All these connections are much more bound up on the kinds of social graphs and maps that Pete Dewan showed us earlier. Looking closer here, we begin to see how this works at a microscopic level. Daily challenge users are in blue. The red dots are their Facebook friends that they invite. This particular person invited a lot of people that didn't convert. These people invited a number of overlapping friends. Several users had friends in common in their Facebook friend network. Those friends got invitations from multiple sources, and they were more likely to convert into daily challenge users than not. So if social connections are so powerful, then how can we use the data that we have to get a lot smarter about forming those connections and promoting the propagation of the application across people's social networks? We sit on a lot of data. So far, we have extracted through the Facebook application environment additional data about our users. And again, all of this information at enrollment, people give us permission to access so that we can build a more effective application. But of 88,000 Daily Challenge members, we have pulled an additional 20 million of their Facebook friends who have millions of hundreds of millions of connections between them. So the question before us is, what does it look like to utilize that data and the intelligence that we have on the social network side to build a more effective invitation process and engagement process? So we recently launched an experiment, and I'll show you some preliminary data here in a minute, that takes a different stab at the invitation process. Here we put before you some recommendations about who you might invite into the program. These invitations come from various algorithms that we're experimenting with. So the 4 that we're looking at here, one is our baseline, which is a random selection of your 280 Facebook friends. A second algorithm is just highlighting a Facebook friend of yours who shares your last name, and the presumption that you're related. Another algorithm that we're looking at is highlighting the Facebook friend who connects you to the most Facebook friends that you have. And the last is the Facebook friend of yours who not only connects you to the most friends, but the most friends who are daily challenge users. Looking at this a little closer, just by way of illustration, this is the third algorithm that depicts me as the inviter. In this case, I have 5 Facebook friends pictured here in blue. The black lines indicate that we are connected on Facebook. The orange lines indicate that my friends on Facebook are how they're connected to each other. And we see that the target up at the top is the one friend who's connected to the most of my friends. So that's the person whose picture we're going to put on the top of the page there. So here are the results. Pretty interesting, still early in the process, but we're reaching an interesting level of scale, and we see some very promising opportunities here to really drive social propagation and diffusion of the application. So the random is our control group, as it were, with a success ratio of 1. The last name algorithm improved on that by significant percentage. The friends in common algorithm, the one that I just showed you the sort of brief social graph of, improved slightly more. And then finally, the algorithm that recommends to you that friend who connects to the other people who are your Facebook friends who are also daily challenge users outperformed random by 2 times. We're going to continue to experiment here. We're collaborating with MedNetworks and Christakis' group to really tease this apart, to dive deeper into the data, to understand the power of influence, and that we can glean to come up with smarter, more intelligent ways of doing this. So, in sum, our goal obviously is to continue to grow. We expect to grow the Daily Challenge to some 250,000 users by the end of this year. We're also launching additional services, premium services that will add additional daily challenges aggregated into topical tracks that will be paid services, either paid for by individuals directly with a credit card or through sponsors, employers, and health plans. So look for a lot more from MIU Health in the future as we experiment with really how to leverage the social network science, game science, the latest trends in behavior change to build more effective social applications. Thank you. So I'm going to take a few questions here. The first question is, are there tracking mechanisms to track when people meet their goals with these programs? There's lots of aspects of our program that keep track of what people do, what your friends do inside the program, so that you can keep track of your own progress as well as the progress of other people. Next question, what recommendations do you have for employers who limit social media access? This is a good question. It comes up all the time. The important thing to remember is that this is an activity that people can engage in anytime, any place. You can engage with the program through SMS messages, mobile phone applications. It doesn't require Facebook. It won't require Facebook access as we evolve this fall. Right now, this is a Facebook Connect application, which leverages and requires your Facebook login. Over the course of this summer, we'll be adding other mechanisms to enroll people. But one of the messages that I think to leave you with is that most of your employees or sort of health plan members do have access to the internet outside of private office networks, and we're trying to build a system that is as an open system that allows people to connect with the program in a variety of ways and bring those people who they, in their real lives, that they really want to work with. Next question, do employees build social networks from people outside their organization? One of the great advantages of the program that we've built, which is kind of a classic freemium model where there's a basic free service, and everything I showed you today is available for free at dailychallenge.com. Anybody can invite anybody to join them in the program. If you believe the connected idea that's been promoted by Christakis and Fowler, that we are all connected, then it's important as application designers that we build applications that let people leverage the real connections in their lives that are meaningful to them. So we built a really novel system that allows for this interplay between working with your employees as a group and also letting them invite other people into the program. How does the success of social media programs compare to telephone-based programs? One of the things that I can point to out of my own experience, having worked with the QuitNet program, QuitNet online smoking cessation program that started 15 years ago as a project at Boston University School of Public Health, eventually commercialized and now a program owned by Healthways. QuitNet started as a web-based program, added telephone coaching, and goes to market as a comprehensive phone web-based interaction model. And the evidence is pretty clear. If you give people a choice about how they want to interact with the program, either telephonically or through web-based support or combining the two, that you're going to get the best results. You're letting people interact through the modality that they're most comfortable with. Next question. Do you monitor the content individuals share? Individuals share for inappropriate comments. We take what is a typical approach for large online systems where we don't screen this stuff in real time because we don't want to get in the way of genuine interactions between people. We do carefully screen stuff, post-process stuff automatically, looking for, obscenity and other keywords. And then if we identify problem users, we have strategies for working with them or ultimately ejecting them from the site. But it rarely comes to that. Having worked with online communities now for 10 years, there's only a handful of instances where we've gotten into serious trouble. For the most part, over hundreds of thousands of people come to these things wanting to have a genuine, positive experience. So thank you very much. I'm now going to pass the baton to Jim Prochaska from ProChange.